Hello and welcome to BOOBSBY Plastic Surgery Show. My name is Amadej Lah. Let me just show you my addresses. So follow me on Instagram, visit my webpage, and please subscribe to this YouTube channel. Today we are speaking about Botox and hyaluronic acid. You will learn everything you need to know about the difference about these two products, so everything will be completely clear what you need in which part of the face and for which problem. So Botox and hyaluronic acid, they are the two most common treatments that we do on an aging face. It's both are similar in the way of simplicity, of safety, but they are two products that are quite different in the way of the problems that we treat. So let's start with Botox, maybe. Okay. What is Botox? Botox is it's actually a poison. It's a botulinum toxin. It's a small protein that actually is in nature being produced by bacteria, and it's a poison that actually connects between or blocks the motoric plate. Motoric plate is the ending of a nerve where it attaches to the muscle. So it blocks this end plate, this motoric plate, so the nerve cannot longer move the muscle. Well, it sounds quite scary and spooky, but yes, it is a poison. Yes, it does block the muscle, but the way we use it is in a really small quantities and in a really controlled way. So the probability of any side effects and complications is really low. It looks like this. We usually use this port in our country. I don't know about you, but this is a product that is quite old and it works really well. Inside the box there are 1 or 2 vials, so small bottles, like this one. It says this port, and inside of this vial is a piece of white powder. So to use it, first we need to dilute it with some water, so we can use it then in a syringe. Then when we fill this with water, it gets diluted and we get something like this. So it looks like water, but of course this is the product diluted inside the water. The needles we use for Botox are extremely small. These are the thinnest needles there are. They're like, I mean, they're thinner than hairs. And sometimes when you do an injection with this needle, you don't even feel it entering the skin. It's so extremely thin. So as I said before, the Botox works on muscles. Which muscles? So we the professionals who do this treatment, of course, know the anatomy quite well. And in using Botox, we usually treat the forehead, so the muscles that do this. Then the area between the eyebrows, the muscles that do this. Then the area around the eyes, the crow's feet, so the muscles that do this. Yeah. These are the most common areas that we treat. We can use it also for some other areas, but it's much more, much less common to do that. We can use it a little bit around the mouth, especially for the vertical smokers' wrinkles. We can use it in the chin area to lift up the face a little bit, but it's a very subtle result. And in older people, we can use it on these vertical lines to fix the platysmal bands. So what does it do? Once it blocks the motoric plates, it prevents the muscles to move when they get the signal from the nerve. So if I'm speaking to you like really using a lot of movements, it would block that. So I would not be able to move my forehead as much as before. Usually we do not completely block the muscles. We leave some movement to leave it more natural. Some people like to have this completely blocked or frozen look, but most of us prefer a subtle effect. So there is still, of course, normal movement, but not as strong as before. The other effect of Botox in areas we treat is its anti-aging effect. The areas that we treat, are then move less. So, and if they move less, the wrinkles that are caused by muscles, like the forehead horizontal wrinkles, the number 11 wrinkles, and around the eyes, they are much less pronounced, even in the long term after treatment. So, if you do a treatment like this regularly, these wrinkles won't even appear. That's why it's a good anti-aging product in low quantities. That's why we get young girls, let's say 25 plus, who do Botox in a very small dosage, maybe only once a year to prevent aging, to prevent wrinkles. The effect of Botox usually lasts between 4 and 6 months. There are people where it lasts less than that, like 3 months. It's very rare that it would work more than 6 months. Usually 4, 5, maybe 6. What else can we do with Botox? Well, it's very useful for treating asymmetries. Some people, maybe after a stroke, it can be used to fix that. Then it can be very useful in maybe some accident or something. When there is nerve damage, we can use Botox to make face more symmetrical. What else? We use Botox very successfully in areas of sweating, like armpits. Botox can be used to prevent sweating for about 6 months, even more, 6 up to 9 months. So we inject it very superficially into the skin. It blocks the sweat glands, and you are sweat-free for 6 months or even more. A very useful treatment. Then what else? Well, it's used also, of course, in other fields of medicine, like neurology for other problems. But in our field of work, that's about it. So, face to treat wrinkles caused by muscle movements, so forehead around the eyes, and of course sweating and prevention of sweating. That was Botox. The other product that we use is hyaluronic acid. What is hyaluronic acid? So hyaluronic acid comes in boxes like this, different products, and if we do a small unboxing, it comes in syringes like this. These are pre-filled syringes, so these are full of the product, of the hyaluronic acid. Hyaluronic acid chemically is a sugar, and it's a natural sugar that actually is part of our body, of our skin, joints, eyes. So it's a natural product, and it does not cause any, let's say, reactions, because the body does not recognize it as a foreign material. The hyaluronic acid in our body comes in single long molecules. If we would use such product in our skin, it would get reabsorbed immediately, so it would not make any lasting effect. So what these factories did, they cross-linked many of these long molecules, so they became like this, like a matrix. So once you inject that, it stays inside the skin much longer. How long? It depends a lot on the part that we treat. Well, first let me talk about the areas that we treat with hyaluronic acid. We use it as a volume substitute. So that's the difference to Botox. Hyaluronic acid is gel. It's dense. Look, I put it here. You can see. So it's gelatinous, and once inside the tissue, inside the skin or wherever you inject it, it will make volume. So it will fill it up. That's the difference to Botox. The Botox releases the muscles, does nothing with volume, does not change volume. Hyaluronic acid changes volume. It plumps up, it adds volume. So we use hyaluronic acid in areas where we want to increase the volume. So typically in aging phase, as I was speaking yesterday, there is loss of volume and a loss of fat in the different parts of our face. So we can use hyaluronic acid to fill it up again, to make it more useful. Usually, the most common places that we use it for is, of course, the lips, to make it bigger. Then nasolabial folds, these are the folds between the nose and the angles of the mouth. Then we use it in our cheek to make it rounder. We can use it in our cheekbones to make it, like more pronounced. We can use it along the jawline to make it smoother, to make it the shape more regular, rounder. And I mean, also maybe in the nose to fix some irregularities with the nose, and many other locations. So wherever we need the volume, we can use hyaluronic acid. Hyaluronic acid by itself, like I said before, doesn't do any much reactions or negative effects. It's a very natural product. Sometimes, I mean, you can overdo with hyaluronic acid. That's the problem. I mean, there are people that you see on internet, that you see around yourself, that overdo hyaluronic acid. It's that the effect of doing too much of HA, so hyaluronic acid, it's much more visible than too much Botox. I mean, if you give too much Botox, okay, the person will not be able to move the forehead around the eyes much. But if you overdo hyaluronic acid, they get these huge ugly lips, or too prominent cheekbones, or round faces, big chins. That is the effect of overdoing hyaluronic acid. So I mean, the aging of the face is loss of volume, but just the volume will not fix all the problems of aging face. Of course, some other procedures are usually necessary to fix it completely. So hyaluronic acid comes in different forms. I showed you different bottles. So like, there are different densities. So there are products that are denser, so more compact, that we would use for places like deep places like cheeks or temple area, where we need to actually add volume, add substance. This is like one of those products. Then on the other end of spectrum, there are products that are really thin, like liquid. Those we use for very superficial areas, maybe the fine lines above the lip, or in the angles of the mouth, or superficially with this horizontal, very thin, fine wrinkles that appear during smiling. We can also use these fine products for the neck, for the horizontal lines, like this one on myself. So the product we use actually depends on the area we use it for. Then we also have products in big packages like this one. The size of the syringe is huge, so this is like 10 milliliters product. Products like this are being used to augment bigger areas. We use it for gluteal area, so to enhance the buttocks, especially in girls that do not have any fat, because usually we do the buttocks by using fat, but in skinny girls with no tissue to take, we use something like this to make it bigger and rounder. We will speak about beauty some other time. So what we can do about buttocks areas. So this is the difference between Botox and fillers. I hope I made myself clear. recovery time after all of this procedure is very short. Usually there is zero recovery time. Sometimes, when we inject the product, a small bleeding can occur, but it's usually very local and very limited. So some corrector, and it's not visible at all. And many of our patients come to do these procedures during their lunchtime, so it's like 15-minute procedure and they're back to work. I heard from some of my viewers that I have a problem, and that is my forehead and my wrinkles. So what do we do with that? I do Botox for myself usually, and I can show you now how it's done. I will just do 2 small injections now and finish afterwards, so you don't see me suffer so much. As I said before, the needle is extremely thin, and usually you don't even feel the pain when you're injecting. So here is my nice mirror, and let me show you how it's usually done. So holding the skin and entering like this. Okay, number 1, and the other side like this. So I will finish myself the forehead just to get an idea how pain-free that is. I mean, it's complete. I mean, almost you don't even feel much. So I will inject myself the forehead around the eyes, and then the next week, when the effect starts to show, the Botox effect usually becomes visible after 5 days. We can check how I am doing. Let me just clear the blood. And so that's it. The effect of hyaluronic acid lasts a little bit longer than the Botox usually, so it depends on the area. The cheeks maybe up to 1 year, around the mouth about 6 months, nose or around the the lower eyelids even more, up to 2 years. Okay, that's all that I wanted to tell you today. We will see each other tomorrow, and thank you for watching. Bye bye.